we got a little bit better in our development, and we developed Alupent and Proventil. You do need to know the generic and the trade names for these three medications because you're going to see them a lot in your nursing career. You know, I told you there are 11,000 drugs and you can't know them all, but there are a handful, a few dozen, maybe 100 or so that you're going to see so often that you really need to know, that you need to commit them to know. Now, respiratory therapy is usually going to be the one who administers these medications because they're administered via inhalation. But you as a nurse need to know when you're teaching your patient what to expect with these medications. They dilate the bronchioles, and they do have some other side effects.
Is Zopinex considered an albuterol? I thought it was.
I don't know whether Zopinex is or not.
Yes,
Is it?
it's a substitute for albuterol.
For albuterol, okay. Is it the same thing as albuterol? Is it a...
It is,
The generic albuterol?
It doesn't have some of the side effects that albuterol does.
So is the second generation, is it more like Alupent? Zopinex? I don't know.
I've been told, my pediatrician said it's comparable to albuterol.
Right. Well,
We don't know whether it's the same thing.
less side effects and it lasts longer, but I didn't know if it was the same family.
I don't know, it's the same family, but I don't know whether it's the same, whether, you know, we have these generations of drugs. The first one actually was the Ishiprel, was the first one that was developed. Albuterol has a long, it lasts for a long time, has a long duration of action. And Alupent is a selective beta-2 agonist, adrenergic. So we as nurses, what do we have to know? A little bit more about these medications than I know right now. We have to teach, I'm sorry. We have to teach our clients how to use an inhaler, okay? We take one at home. We have to teach them the correct dosing intervals, nursing responsibilities. We have to tell them the side effects of these medications. So what are some side effects that we can anticipate clients may have? Increased heart rate, increased respiration, increased irritability, anxiety, right, and blood pressure can go up some. Jittery, exactly.
Immediately.
Yeah.
Immediately, yes. Amy, you just had it, right?
Yeah.
So what happened? Tell us about
I felt
that.
like crap. I had my daughter with me. She was a doctor with me, and I felt like I was going to strangle her because she wouldn't, you know, everything. And just my temper was. I was just thinking, ugh, like, you know,
Big
stress.
increase.
There was just stress. I felt stress and anxiety, and I could breathe better.
Breathe
but
better.
My attitude immediately. I just felt like, you know, my blood was pumping.
It was pumping because you had to escape from the tiger. Unfortunately, you were trapped in a room with a little child.
She wanted to, like, she was trying to color, and she wanted me to spell words.
Uh-huh.
Like,
She
that's
wanted-
not what I want to do.
No, I don't want to do that. Right. She wanted you to be mommy.
Yeah.
So all of these medications have the capacity to make clients irritable. Now that usually settles down over time. Clients usually begin to tolerate those symptoms, and they become less noticeable and less worrisome. But you know, if you have a patient who gets terbutaline who's pregnant, one of the things they'll complain about is tachycardia, okay, and irritability. So how much tachycardia do you think is too much tachycardia? I don't know the answer to that question.
Can you take your drug?
Beg pardon?
Albuterol when you're pregnant?
Say again?
Can you take albuterol when you're pregnant?
Yeah, it's one of the few that's safe, yeah. Nursing process on page 607 and 608. I did not put on this PowerPoint. But it's in your key, it's in keys in the blue, and I don't know what equivalent is in the 6th edition. I'm going to trust you guys to find that, okay? It's important content.
Just as we're speaking of tachycardia,
Yes. Hold on. Zopinex,
versus albuterol, it's in the heart rate. The Zopinex has, it doesn't increase your heart rate.
Doesn't increase the heart rate, so it must be selective in terms of which receptors that it stimulates.
It's not as much because
Not as
it has
much.
a different blend of the albuterol.
And probably, when we talk about selective inhibitors, we have alpha-1 and alpha-2 and beta receptors. Sympathomimetic receptors respond to different things when we're running from the tiger. And some organs have got both, and some have got one or the other. which is why you'll see GI symptoms with some and not with others. And you'll see increased heart rate with some and not with others. Because it depends upon which receptors those individual tissues have. And I wish I could sit here and tell you all right now, this tissue has this, and the finger has this, and I don't know. You have to learn that specifically with the medications and with the tissues that you're targeting. But when we design drugs, we're targeting so that we decrease side effects. Because we know that if we have fewer side effects, our patients are going to be more compliant with the medication. Yes, Crystal?
I think teaching is important too with an inhaler because I've never.
Teaching is extremely important.
I never had an inhaler, and
Right.
I got prescribed one last week, and literally
how do
had
you
to
use
go home and read the directions
Well,
because I
they
had
should-
no idea what
They
to
should
do.
have showed you, because with some of them you take them, you know, with the first puff, and some of them you exhale first, and some of you, you know, it depends upon where you want to be. And if you have a combination inhaler, you know, if you have 2 inhalers, and I can't tell you this because I can't remember, I have to look every time. If you have a glucocorticoid that decreases inflammation, you want to get that deep in the lungs, you want to use your inhaler that opens your bronchioles before you use your inhaler that decreases inflammation. And so, which one do you use first, and how much time is there in between? And yes, those are very important things to teach your patients.
I have to use the one that expands first and then use the other one.
And did they tell you how much time to lapse? You got 2 inhalers?
Yeah, I had to ask the pharmacist because the other.
The nurse didn't tell you.
No.
Well, the pharmacist is supposed to give you, they're not supposed to hand you your medications without making sure you know what they're for. That's why you sign that.
That's right, you sign that little piece of paper that's supposed to tell you what they're for and how to use them. But the nurse or the physician who gives you the medication should tell you how to use them.
They said, do you have any questions? I said, yeah, what do I do with them? I don't know.
Good.
So-
It's good that
so
you
they-
asked. What if you hadn't asked?
Yeah,
You
so,
said, yeah. Do you have any questions? No.
yeah, as far as like you have to prepare them first, and there was a couple of pumps first before you actually use it. And if
You gotta
use it
prime the
for hours,
pump,
like,
right.
Yeah, I didn't know any of that.
It's not that, it's not necessarily so simple.
I didn't even have to read directions.
You have to read the directions and you need to be shown.
I had to read them too to make sure I understood.
You need to be shown. And so, and you can, you know, we can all read. What happens with someone who can't read? Or someone who's so upset and confused when they get the prescription that they don't hear anything. So Medline, isn't it Medline that's got that? There's a real good system the hospital has, all of Wellstar has, that
Micromedics?
Micromedics. Oh, hi, how are you?
Hi.
Yeah, I'm glad you're here. Can you add to my lecture, because this is not my,
Forte.
not my forte.
Micromedics is just a really great resource. It has patient teaching in it.
Right, no, I was talking, they've had that, I'm talking about what I've said so far. Have I said anything wrong?
You just got.
I just got your opinion.
Okay.
Not so far.
That's so far as we know, yeah, so. But anyway, so that is our role. And that is this for now. It's almost.